Good morning and welcome. We are live today with Dr. Davis Brockenshire, and he is one of our featured presenters for the Virtual Neurology Summit. Now, if you haven't already grabbed your ticket to the Virtual Neurology Summit, I wanted to let you know that it's going live January 25th through the 28th. Now, live today, again, with Dr. Davis Brockenshire, and he's a doctor of chiropractic, applied kinesiologist, and Western physiotherapist. He has 20 years of clinical practice experience and 12 years of teaching internationally. Originally a sports chiropractor, Dr. Brockenshire currently practices applied functional medicine and functional neurology. Now, continuing the legacy of pioneers and mentors, his mission is to support the future generation of healers and practitioners through practical application of complex information. Now, I can't wait to learn more. Dr. Davis, would you mind telling us a little bit more about you and what made you want to become a healthcare provider?
Sure, Krista, thanks. Originally, I was a financial planner, but at the same time, I was competing at the elite level in mountain bike racing. And as you know, it's not the safest sport in the world. So injuries lead to more injuries. And I met a chiropractor through my attorney, and one thing led to another, and I fell in love with neurology because it made sense to me.
Yeah.
And so that took me into sports chiropractic, treatment of TBIs, concussions, etc. But also traveling internationally, I started to see a lot of the symptoms of TBI show up in people that had vaccines like yellow fever and typhus. So I started to make the connection between the chemistry of the immune system and neuroinflammation. One of my mentors in herbal therapy is Professor Kerry Bone, and we had many discussions about this concept of neuroinflammation and chronic pain. And so that's where we are today, is kind of on the leading edge of understanding the brain and how it perceives pain, not just from physical injury, but from chemical and emotional trauma.
Absolutely. For everybody who's joining us live, this is Dr. Krista with the American Posture Institute, and I want to introduce to you our special guest, Dr. Davis Brockenshire, again, a featured presenter at the Virtual Neurology Summit, which goes live January 25th through the 28th. Now, I want you guys to give us a like on Facebook if you've grabbed your ticket to the Virtual Neurology Summit. So today we are talking about neuroinflammation and how it impacts chronic pain. Now, the cool thing is you're going to learn a lot more about this on the Virtual Neurology Summit when you hear Dr. Davis Brockenshire's presentation. But if you could just give us a little sneak peek, talk to me a little bit more about where you see neuroinflammation having an effect on chronic pain.
Well, a good example for that, Krista, is the whole concept of chronic fatigue or fibromyalgia. And if we lump all that together into CSS or chronic sensitivity syndrome, that's where you really see the wasting of chronic pain. And in a lot of those cases, it all goes back to the immune system and the whole gut-brain axis. So
Sure.
Most of my work falls into looking at this gut-brain idea across the spectrum of issues, from autism to Alzheimer's, looking at dementia as a public health threat. We get into these ideas of cloaked pathogens and stealth pathogens, particularly Lyme disease in my practice. And we see all of the co-infections that go with Lyme. And today I was watching an interview with my old neighbor in LA, who's a news reporter, and he did a whole thing on Cipro and the fluoroquinolone class of antibiotics and how it's leading to neuroinflammation, joint pain, MS-like symptoms. Wow. And also there's this massive intersection across our field, and all healthcare providers are affected. And so I'm excited to be part of this summit so we can share ideas and also hopefully stimulate some more conversation.
Beautiful. Now, when we talk about chronic pain patients, we're talking about highly complex patients. There's no textbook answers to chronic pain. Each patient presents with a unique presentation, and it can be due to multiple factors. We know that chronic pain is, in fact, an output signal of our brain. So what I love about your introduction is you said to me, I like taking these complex ideas and helping other healers and practitioners take these complex ideas and make it practical with practical application. And that's what we're really striving for with the Virtual Neurology Summit. Again, for everybody, it's going live January 25th to 28th. It's not just about having information, but it's how can we take this information and actually apply it to our patients. So give me like a clinical takeaway that you would say for anybody who's interested in, I'm seeing these patients on Monday morning, I have a busy practice. How can I learn more, something practical to utilize in practice regarding chronic pain patients?
Well, the first step is, like Dr. Goodhart used to say, you got to look with better eyes and hear with better ears. So we have to brush up on our observational skills. And I like the way the American Posture Institute's going with visual recognition and eye movement, but also looking at posture as a key tool in assessing dysfunction. And in applied kinesiology, we've always done that. But if you just start Monday and do a basic Romberg's test on every patient you see, and then modify it and have them stand on one leg and see what happens to their brain when they try to do that. It's going to frustrate the patient, but as the practitioner, it starts to open the door for you to do more for that patient, whether it's through nutrition or functional neurology exercises. It really is fascinating when you see patients recognize that they can't do something they should be able to do.
Yeah. And even when it's something so simple, that's only going to take you about a minute to do with each patient. For example, just within 30 seconds, you can do a Romberg's and then you can do a one leg balance, and you can get that feedback right away, and so can the patient. So there's a huge amount of power to that because you're seeing information plus the patient is seeing information about their case presentation. And then when they can see after a treatment that they can do it better, now they have instant feedback that changes are happening within their neurologic system. Everybody who's joining us live, give us a like. If you're joining us for the Virtual Neurology Summit, it goes live January 25th through the 28th. We're talking live today to one of our featured guest presenters, Dr. Davis Brockenshire. Now, his topic for the Virtual Neurology Summit is neuroinflammation and chronic pain. Now, as you're joining us, you're understanding that, wow, chronic pain is really complex. There's a lot of considerations that we need to think about as professionals and practitioners. So what's great about the Virtual Neurology Summit is that we're getting together a panel of experts in different healthcare professions and fields and saying, let's take some clinical application away from each of these different fields and fields of thought, and how can we apply these to our everyday patients? So Dr. Davis, when it comes to when you say listening a little bit better and having this visual perception, like we're watching better and we're listening a little bit better, how can we integrate this with our therapies, but also with our case histories that we're doing with our patients?
I think practitioners need to embrace technology a little better. Nobody likes taking notes, but if you've got a tablet or a device in the office that's, HIPAA compliant, you can shoot video and shoot images, and you can download many apps that do posture grid video. So take before and after posture shots, do motion video, have them do vertical or horizontal pursuits in the office and watch them change in front of you. Like we said earlier, when the patient gets involved in their care, and it doesn't have to be supervised care, they'll embrace the change that you're offering them, and they'll be wellness patients for life. So use technology to your advantage, not just because somebody's telling you to, but because it works.
Yeah, such a good practical takeaway. And again, I just want to say from experience, working directly with patients, again, when they can see a pre and post change, that means so much more to them than you just telling them that they've had a change, right? So now instead of just talking at the patient, when they can see that, then that's instant feedback for them, and it's instant feedback for you that what you're doing is creating a change to the neurology. So I love what you just suggested there by utilizing technology to our advantage. Now, again, for everybody who's joining us live, Virtual Neurology Summit goes live January 25th through the 28th. So Dr. Davis, can you just give us a little preview of what it is that you'll be discussing for anybody who just joined us live on the interview? Just kind of a brief synopsis of your presentation for the Virtual Neurology Summit.
Sure. In the 30 minutes I have, I'm going to walk you through why your patients are becoming more complex and explain to you a lot of what you've already seen, but couldn't quite put all the puzzle pieces together. And we'll walk through this idea of leaky gut and leaky brain and what it means to have membrane permeability that's starting to fail. We'll get into blood-brain barrier dysfunction, but I'll also give you some demonstrations of how to incorporate some of these exam features in your practice. Real easy, but also how to challenge your more difficult patients who think they're all that. And if you're working with pro athletes from a TBI point of view, they do think they're all that. And so when you put them through certain maneuvers and they fail, man, that is an aha moment, because they do not like failing. They don't like being told they've got something wrong. So you'll see all that in the presentation, and I'll be able to close it out with some nutritional tidbits and some clinical pearls regarding some things that are widely available that give your patients more power over their health and their wellness future.
Beautiful. Clinical pearls. You heard it right there. By watching this presentation, you're going to get clinical pearls and clinical application that you can utilize right away in practice with your patients. And the best part about this is you can actually get a free ticket to the Virtual Neurology Summit. Our goal is to increase the amount of knowledge and awareness out there of the neurology behind chronic pain patients, because we understand the complexity and we know that more and more patients are presenting with chronic pain. So do yourself a favor and become an empowered practitioner. Grab a free ticket to the Virtual Neurology Summit, join myself, Dr. Davis Brockenshire, as well as 23 other experts in the field of neurology and chronic pain. All right, we are going to wrap it up right there. I'll post the link to the Virtual Neurology Summit. Again, it goes live January 25th to the 28th. Dr. Davis, thank you so much again for being here with us live, and of course for your participation in the Virtual Neurology Summit. I just want to let you know how much we appreciate you and your participation, and thanks for sharing with us to help all of us up-level our clinical knowledge.
Thanks for the opportunity to share.
Thanks.